Welcome to the course development project for the traditional Bachelor's of Nursing Medical Surgical Nursing 2 course. The location of this medical surgical nursing course is within the second semester of the third year of this 4-year nursing curriculum, as these nursing students have already honed in on some of their basic nursing skills and completed all of their prerequisites during the first 2 years of the bachelor's program, as well as completing some of the more basic clinical rotations. Placing Medical Surgical Nursing 2 in the second semester of the third year allows the instructor to assist the students in correlation of more advanced nursing theory to a fast-paced clinical skill setting that demands the nursing student begin to care for multiple patients at a higher acuity level. Upon completion of a successful Medical Surgical 2 clinical rotation, the student would then move on to more specialized and advanced nursing clinical endeavors, such as the ICU and the emergency department, prior to beginning clinical internships at the end of their 4-year rotation. The philosophical approach utilized to create this course is constructivism, as it proposes the idea of instructor-guided learning of knowledge created by the student. The course will also incorporate interpretive pedagogy, which allows the student to learn throughout experience. Utilization of these techniques allows the student to continue to grow in both knowledge and clinical skill throughout each semester. As previously noted, Medical Surgical Nursing 1 will provide the student with basic nursing skills. Utilizing this constructivist approach along with interpretive pedagogy allows the learner to create the knowledge and continue to learn and flourish throughout their experience into Medical Surgical Nursing 2. The rationale for utilizing the traditional approach includes the fact that Medical Surgical Nursing 2 will expand experiences created in the classroom and clinical environment beyond a conventional nursing education paradigm in consideration of the 2010 IOM recommendations for changes in nursing education, linking classroom to clinical learning and advancing nursing education, as well as bringing previously acquired student knowledge to the learning environment. The traditional format influenced the course by providing structure to the learning process. This structure allows for the amalgamation of online resources and modern technology within a simulation that allows the student to build upon and interpret knowledge gained within the classroom experiences and utilize it safely within their clinical experiences. In an effort to incorporate the educational and nursing practice growth and educational transition expectations of the IOM 2010 Future of Nursing Report, philosophical foundation of this third year, 6th semester Medical Surgical 2 course states, the course mission is to expand the growth, knowledge, and skills of the student nurse within a diverse, fast-paced environment that provides an interprofessional atmosphere facilitating transition from basic to advanced nursing skills. Program outcomes correlate with the philosophical mission, ensuring that the program incorporates quality, safe patient care delivery within a diverse population as outlined within the 2010 IOM. The program outcomes correlate specifically with course outcomes, with the end of course outcome expectations founded on the philosophical mission of expanding the growth, knowledge, and clinical skills of the student in a more diverse, faster-paced environment, transitioning the student from basic to advanced nursing skills. The student will become more independent and confident, have increased prioritization and time management skills, apply critical thinking skills more appropriately, collaborate and communicate with peers and patients at a more professional level, and become a more valued resource with the ability to comprehend and describe evidence-based practices and research in relation to patient care within the clinical environment. This course is traditional. However, it will incorporate some of the hybrid techniques that provide for the most up-to-date teaching technologies, such as a computer lab and utilization of online courses. Medical Surgical Nursing 2 also provides a current solid base of design, delivery, and location, utilizing a modern clinical simulation laboratory, as well as a large teaching hospital venue and inpatient dialysis unit for clinical rotations. This course utilizes two of the most current and up-to-date textbooks to ensure student comprehension of a curriculum that is well designed, as well as providing valuable student resources. The evidence-based nursing education is obvious in this course via mode of delivery of theory material through the most current and detailed textbooks and up-to-date online resources, including the simulation laboratory and use of a large teaching hospital for clinical rotations. This traditional bachelor's in nursing program embraces the use of new technologies and interprofessional relationships in the clinical environment that ensure the interprofessional relationships discussed throughout the IOM are incorporated into learning strategies. One example of how this course calls for transformation in nursing education includes the assurance of safe patient-centered care through utilization of the simulation laboratory for skills teaching, learning, and assessment. Another great example of how this course meets the expectation of the IOM includes the development of competencies and evaluation of outcomes processes to ensure the student is meeting benchmarks throughout the course. Placement of this Medical Surgical Nursing II course within the traditional Bachelor's of Nursing program allows for steady student progression of learning and expansion of knowledge both theoretically and clinically. Other valuable resources utilized to develop this course include the 2010 IOM, as well as information from the Association of Perioperative Registered Nurses, the Centers for Medicare and Medicaid Services, SUNY Upstate's Department of Physical Medicine and Rehabilitation, and the World Health Organization. Thank you for your time and attention to the development of this Medical Surgical II Traditional BSN course. And remember, keep calm and nightingale on.